Hey guys, Dr. Sarah again. Now today's video we're going to talk about Ozempic and particularly Ozempic face, which has really started to come along in social media now. People who are on Ozempic for weight loss have really started to notice some changes in their face in terms of aging changes that were unexpected. So what is this medication? Why are people using it? And more importantly, what is Ozempic face and what does that actually mean for the use of this medication? Now, I'm a skin and cosmetics doctor, so I specialize in non-surgical aesthetic treatments, and I love talking to you guys about these types of treatments and procedures so you have as much information as possible when it comes to making decisions about things that are available to you. Now, Ozempic is actually a diabetic medication that is used to improve blood sugar, improve insulin resistance, and it also has the effect of delaying gastric emptying and making you feel fuller for longer. So it has effects on weight loss. Now, there are some doctors that are prescribing this for people who wish to lose weight, and I think in particular circles, in particular social circles, this medication is probably being prescribed a little bit loosely. And I think this article about Chelsea Handler sort of sums it up basically. She says her doctor just handed it out to anybody. She said that her doctor told her if she wanted to lose 5 pounds that she should use this medication. Now, obviously, Ozempic is a medication that is, well, that's the brand name. The generic name for this medication is called Semaglutide. And it is really, a really important medication for diabetics to have. It can really help regulate their diabetes and improve their symptoms. So when it's being prescribed for people who are trying to lose that little bit of stubborn weight or lose small amounts of weight in terms of a kind of more aesthetic indication, then I don't know how I really feel about that. I think that there are probably other ways that you can lose weight more successfully. Maybe not more successfully, that's probably not actually true. It's pretty successful at getting you to lose weight. But I've seen articles of people saying that once they stopped taking semaglutide, they put double the weight back on. And obviously now we're seeing people talking about Ozempic face. Now, so a diabetes drug being used for weight loss. Chelsea Handler has been using it. There have been many other celebrities that are using it. And also I even know some patients who come and see me in the clinic here who know of people whose doctors have put them on Ozempic to help them lose weight. She said, if you ever want to drop 5 pounds, this is good. The medication is not intended for people who need to lose just 5 pounds. Ozempic, or its counterpart Wegovy for people with obesity, works in the brain and shifts the person's fat mass set point. This is coming from an obesity medicine physician at Yale in America. So basically, Chelsea Handler, which I find this story problematic in a few areas. She had it prescribed inappropriately. She came back from vacation and she injected herself with it. She went to lunch with a girlfriend. One, she didn't actually know that that was the specific medication that she was taking or that she had been prescribed. She had these symptoms like nausea, really reduced appetite, and her friend was the one who maybe kind of signaled to her, maybe you're taking Ozempic. And she was like, no, I'm not. I'm on semaglutide, which essentially is the same thing. Once Chelsea Handler found out that she was on this medication, she said that she stopped taking it. But she also goes on to say that she's injected multiple friends with this medication and that she had also given her leftover medication to some of her other friends. Again, really not an appropriate way to be using other people's medications. But let's delve into a little bit about why, aside from the fact that that has so many issues when it comes to using other people's medications, using medications inappropriately, and using medications for indications that, really don't kind of fit what that medication was intended for in the first place, we're also seeing Ozempic face. And the reason for this is it's going to help you lose weight and it's going to help you to trim down and also, really help your body mass index, your fat distribution in your body to improve. So you're going to be happy with how your body looks, how your body feels. but it's also going to affect the fat in your face. And we're now seeing this. Now, I've got this diagram here which shows the fat pads in our face as we age and as we get older, what happens to them. When we're young, the fat pads are full, they are providing volume and structure to the face, and they're all sitting in the places where they should be. But this gradually changes as we get older, and we can see that the fat pads shrink, and they also lose the support from structures around them, and they start to migrate downwards. So that contributes to jowling appearance, loose and sagging skin, and the appearance of sort of more fullness in the lower face as we get older. So the forehead, the cheeks, around the orbit, these are all areas in which we lose fat as we get older. And around the mouth and the jaw, we gain fat in these areas, because what is happening is those fat pads are redistributed in where they're positioned in the face. And then in essence, what this leads to is hollowing, loss of volume and structure in the face, contour deficiencies in the face, and a redistribution of fat in the face. So fat in the face for youthfulness is a really important thing. And Ozempic is something that we're now seeing that is really affecting that. So is it having an effect of aging you? You may be looking and feeling great in the body. You may be losing that stubborn weight that you've really kind of struggled to lose in the past. But is that coming at the expense of your face and how youthful and how vital you look when it comes to your facial appearance? So I think that this drug is something that should be used with caution. I would say it should be used appropriately for people who really need it, clinically obese people, people who have got diabetes. And I would really encourage you guys, if you're going to be using it for something like very minimal weight loss, to think twice, because you really want to protect that really precious fat in your face, and you don't want to look older than you actually are just for the sake of losing a few pounds. So let me know what you guys think. Let me know in the comments whether this is a medication you would try. If you have tried it, what's your experience with it? I would love to hear from you. But that's it for this video, guys, and I will see you guys next time.